Hi everyone. Today I'm going to talk about congenital heart disease and the psychological effects that this condition may present. As someone with CHD, I feel that it's important to raise awareness of the integration of mental health treatment in these types of medical conditions. So let's go ahead and get started. So more than 2 million Americans live with a form of CHD. It is the most common birth defect, accounting for about 1% of births in the US. With recent medical advances, more than 90% of those born with CHD live to adulthood. Between 1994 and 2005, about 83% of newborns with critical CHD lived to be about 1 year old, but now around 70% are expected to live to adulthood, and non-critical CHD or simple CHD was now up to about 90% expectancy to live to adulthood. And about 1 in 4 infants born with CHD are considered critical, including myself, meaning that they require a surgical procedure within the first year of life. Symptoms include shortness of breath, irregular heart rhythms, wearing yourself out quickly with activities such as sports, and blue lips, skin, and fingernails, which, unlike the rest, doesn't usually continue throughout life. It's just something that we're born with. Causes. There are no known causes for CHD, but some common risk factors include mainly genetics, like family history of heart disease, uh, diabetes and medications, smoking and alcohol all during pregnancy, and things of that nature. So now we're going to talk about the mental illness and how it pertains to living with CHD. Psychiatric disorders present comorbidity or presenting more than one disorder at a time, most commonly among those with CHD. Between 50 and 75% of children with critical CHD are plagued with disorders such as anxiety, depression, and ADHD. With the increased survival rates in recent years, adults with CHD have about a 50% chance of lifetime depression and anxiety. Now, when it comes to complex or critical congenital heart disease in children, we start to see early signs of social withdrawal, like from classmates, for example, possibly feeling out of place. There is a 25% increase rate of internalized issues in children, like anxiety and depression, and a 15% increase rate of aggression and hyperactivity. All of these behavioral displays are highly likely, especially in those who have had surgical intervention before the age of 2. So, when it comes to risk factors associated with mental illness in congenital heart disease, typically childhood risk factors include genetic factors, of course, such as maybe a family history of anxiety, hyperactivity, depression, something like that. Um, Prematurity at birth is, of course, a risk factor, although it's not very common in CHD patients. Frequent cardiac procedures, checkups, EKGs, echoes, surgeries, they become less frequent throughout life as we age, but whenever we're young, we tend to go to a checkup probably every couple of months or so. And prolonged hospital stays, of course, with major surgery. The child could be recovering at the hospital for weeks before going home to family and friends and anything that's comfortable to them. So that could be a huge factor as well. Now, evolving into adolescence, we tend to have body image issues. Surgical scars aren't usually seen with confidence around this age. So we tend to try covering them up, or we self-conscious. Um, Bullying, of course, is associated with that as well. Surgical stress or trauma, like worrying about an upcoming procedure or something like that. Possible medications. And when you hit adulthood, your parents' bills are now your bills when it comes to procedures and regular medical care. So that's a major factor as well. Um, Disruption of life, that's kind of a big one. For instance, uh, people with CHD, we can't go into the military. There are bigger risks when it comes to pregnancy. We can't really go into active sports. Um, it's a lot of learning to roll with the punches, but we're restricted in a lot of things, so it's a lot to work with. Some more broad risk factors that contribute to mental illness include income. Those with public insurance or no insurance have a higher mortality rate than those with private insurance. In low-income neighborhoods, children have 1.18 times mortality rate, 7% longer stays, and 7% higher hospital costs compared to median income families. When it comes to race and ethnicity, insurance plays a large role. According to the American Heart Association, 75% of Hispanic patients have had public insurance or no insurance, versus 30% of non-Hispanic white patients. Black, Hispanic, and Asian American children are less likely to receive a diagnosis or receive treatment for mental health conditions. This also goes for medical treatment in general. More than 50% of minorities claim to have been unfairly treated during medical treatment. This is a major risk factor to consider as well. So let's talk about mental health care in congenital heart disease centers. What can we do? Previously, mental health of people with medical conditions like CHD has been disregarded. Oncology seems to be the only field integrating these practices up to this point. Recently, the American Heart Association has begun integrating mental health care as a regular part of CHD care from diagnosis at birth throughout the lifespan. Integrating psychologists into CHD treatment can enhance psychological well-being. For instance, one psychologist integrated support groups and camps for congenital heart disease patients. These support groups can create a sense of belonging and acceptance from other CHD patients who can relate and share similar experiences. So, along with support groups providing belongingness, there are some other advantages of psychotherapy integration into congenital heart disease centers. For instance, there is a much greater opportunity for mental health care regardless of insurance or socioeconomic status. So you have mental health care available when needed most, like during a big procedure. Different types of therapy can have some advantages as well, such as trauma-focused therapy, which includes exposure techniques and has been proven effective for children and adults with PTSD. This can of course apply to those with CHD as well, as CHD patients are likely to have PTSD. Cognitive behavioral therapy is another type that has been associated with reductions in self-reported psychological distress in CHD patients. So, for my discussion question, I'd like to know, what kind of mental health treatment options do you think would be most successful for those with CHD or other medical conditions? I personally think meditation and support groups would be most successful, but there's also trauma-based therapy and one-on-one, so it's up to you. Thanks for listening.